Good afternoon, folks. This afternoon's topic A is an overview of ankle pain. So we're going to go through that for A. So please join me for the presentation that I made for y'all. Okay. Like I said, it's an overview of ankle pain. Ankle pain can arise from various anatomical regions and underlying conditions. The video categorizes causes into four main areas: categories of ankle pain, region of pain, common causes, anterior, which is front, anterior lateral, okay, lymphigment, soft tissue, thickening or bone spur, implement, BR, arthritis, post-injury or inflammatory, osteoarthritis, dissencans, chip fracture in the talus. Medial, which is inside, tarsal tunnel syndrome. Okay, then nerve compression, posterior tibial tendonitis, rupture, often missed, leads to foot disformity, flexor hallucis longus tendinous, pain behind the medial malleus, posterior back, posterior ankle ligament or os trigundrum, irritation, Achilles tendons, overuse related inflammation, Achilles tendon rupture, diagnosed via Thompson test or MRI, lateral outside high ankle sprain, syndesmotic injury, may need surgery, low ankle sprain, commonly treated. Conversely, peroneal tendon issues, subluxation, rupture or tendonitis, fractures, calluses or talus processes. Okay, diagnosis, clinical exam, physical tests like the Thompson test for Achilles rupture, imaging, x-rays, CT scan, and MRI. Help confirm structural damage, or inflammation. Treatment approaches: conversive, rest, ice, and immobilization, physical therapy, and acceleric exercises. Let's see, then there's surgical revised for severe cases like tendon ruptures or high ankle sprains. Risks include infections and wound complications. Rehabilitation, early functional rehab is often preferred for tendon injuries to reduce re-ruptured risks. Give me 1 second, guys. These need to come apart. Would you like a comparison of conversative versus surgical approaches for specific ankle conditions, or how these insights could inform mobility assessments and frailty-aware models based on surrounding page content? Here are the most effective conversive treatments for ankle pain. Top conversive treatments. Okay, method: rest and activity modification. Reduces strain on injured tissues and allows healing. Avoid weight bearing if needed. Next page. Okay, and then this one goes: ice therapy helps reduce inflammation and pain, especially in acute injuries. Immobilization uses braces, splints, or walking boots to stabilize the ankle and prevent further injury. Okay, focuses on restoring range of motion, strength, and proper precipitation. Tailored to exercises are key. Particularly effective for tendon related pain. Achilles tendons promotes tendon remodeling. Then we're going to get into pain meds for the ankle. So includes NSAIDs, non-steroidal inflammatory drugs, and dietary strategies to reduce swelling. Okay. Then measures early functional rehabilitation. Encouraged for tendon injuries to reduce rupture risk and improve long-term outcomes. These treatments are often combined depending on the specific diagnosis. Sprain versus tendonitis. Would you like help tailoring these approaches to frailty-aware or memory-friendly care environments based on the surrounding page content and context. Here are some alternative or complementary treatments for ankle pain that could be used alongside or in place of conventional approaches. All right, give me a second. Alternative and complementary treatments. Treatment type, description, and benefits. Acupuncture may help reduce pain and inflammation by stimulating specific points and improving circulation. Massage therapy targets soft tissue tendons, improving lymphatic damage and promotes healing. Chiropractic care focuses on joint alignment and mobility, especially useful for biomechanical imbalances. Herbal remedies, anti-inflammatory herbs like turmeric, ginger, and arnica may support pain relief. Mind and body techniques. Practices like mindfulness meditation and guided imagery can reduce pain perception and stress. Yoga and stretching, gentle movement, improve flexibility, balance, and proper precipitation, especially in recovery phases. Typical treatments, natural creams or oils, e.g., capsaicin, menthol, may offer localized pain relief. Nutritional support, anti-inflammatory diets rich in omega-3 and antioxidants and collagen boosting nutrients may aid in recovery. These approaches can be particularly valuable in frailty-aware care models where minimizing invasive procedures is preferred. Okay. Would you like to explore how to integrate these into a personalized care plan or caregiver training model? Okay, guys, so that is A for you. I'll be back on with B in a few minutes. Give me a few for B, please, and I'll be back on for that with you. Okay?